Hi there, it's Dr. Brenda at Revitalize Physical Therapy. This is part 2 of our part 3 series on pregnancy. So check out the other parts on our YouTube channel. But this video we're going to be talking about pelvic pain or pelvic pressure. So we're talking about some of the most common issues during pregnancy that women deal with in lieu of baby H coming soon. So I thought this would be the perfect opportunity to talk about some of this stuff, especially since I myself have kind of dealt with some of these issues. But anyways, so pelvic pain, people complain of maybe feeling like heaviness on the pelvic floor or pain when they're standing or walking, or also pain during intercourse. So all of that kind of lumps into this category. And really what happens a lot of times is that as you're pregnant, your pelvic floor muscles are working really hard to support the weight of the baby. So if you think average weight gain for pregnancy is about 25 pounds, that's like carrying around 25 pounds all day long, or really kind of like 3 gallons of milk. So that's a lot. You would be really tired. And your pelvic floor is doing that all day long. So what happens is it works really, really hard, and it just gets like really tight and overworked and gets tired. So when that happens, and the muscles tighten up a lot because they're working so hard, they can be painful. You can have like trigger points just from the muscles being tight that can give you pain during intercourse, or you can also have those tight muscles pulling on all the pelvic bones, which is already kind of loose, getting ready for labor, so it can start pulling things and shifting things where they're not supposed to be, and then you feel pain. So, really when you're having issues like that, a lot of people just kind of brush it off as part of pregnancy, or, oh, just give it time and it'll get better. Unfortunately, that's not always the case, and a lot of times we see women coming in where pain is pretty severe and they almost can't function at all. So what we do is work on trying to relax those muscles and release them, because they're so like tightened up from working so hard. So we kind of go in using some manual techniques to help the muscles just kind of calm down and relax. That takes care of the pain issues. It stops pulling on the pelvic bones abnormally, and it also really helps get the body ready for delivery. Because if everything is really tight and spasmed and kind of overactive, it's going to be much harder for things to relax to get the baby out during delivery. So taking care of it during pregnancy and earlier on is really important to get rid of your pain, but also have a much smoother delivery and recovery. So if you're interested in something like that or learning more about that, we'd be happy to talk to you about it, answer questions. Otherwise, we do also have our Healthy Pelvic Floor workshop and Preparing for Childbirth workshop that we host pretty often. So you can check out our website and see when the next upcoming event is if you want to attend and learn a little bit more about it. And we can answer questions there for you too. So again, check out the other parts of this series and feel free to comment or share questions if you have it. So thanks for watching.